2:35. Thanks so much. Good afternoon. I'm taking my mask off here for reasons that will become obvious during our discussion. We have some really good news in Washington State today. Our state will be able to lift the vast majority of restrictions on our business activity on June 30th this year. So on June 30th, a huge number of our restrictions will be removed, the ones that people are familiar with in restaurants and gyms and the like. We are very pleased to be able to announce this. We have more work to do, but this should give us a good path forward in reopening our state. And there's a chance that we could reopen our state sooner if we can get 70% of our eligible population over 16 to initiate their vaccinations by then. We know we have a long ways to go to get enough people vaccinated to save our state. But this is a huge step forward. It is a new chapter in our fight against COVID. It is a recognition that we are moving to a strategy based on vaccination as opposed to restrictions in our personal behavior. We have a vaccine that's safe, that works, that is absolutely free, and we are now moving to full focus on that so that we can save lives in our state. The reason we're able to move to this next chapter in the fight against COVID is that we have started to see a plateauing and declining of actual cases. I'll show on the screen the epi curve. You'll see to the right of the curve, it's coming down, and we're very pleased in the last couple of weeks to see this progress and reduction of the disease proclivity. So our case rates and our hospitalization rates are both coming down. The COVID death rates are also some of the lowest that we have experienced. And is that the death rates you have up there now? Excuse me, you're looking at the chart that shows the hospitalization rates have come down fairly significantly as well. Thank you. And importantly, there is universal access to the vaccine now. This is life-saving. It's free. What's not to like? And now we're moving to the full-throated dedication to protecting our citizens using that mechanism rather than restricting long-term our freedom of economic performance and other things we enjoy in life. Almost 2 weeks ago, we paused our Healthy Washington reopening plan to allow further review of the changes that were occurring in COVID activity. And the pause was consistent with our strategy that has been successful to date of always being willing to review and being very adept and quick in the response against this wily beast. We've pivoted where it was appropriate, where it made sense, and today we believe that this decision makes sense, imminently based on the evidence before us. What we know now gives us confidence that this next chapter will be successful in our state. So here's where we are going forward in the immediate future. On Tuesday next week, every county will have the opportunity to be in phase 3 of Healthy Washington, including those that are currently in phase 2. So we will have a consistent statewide pattern based on state restrictions. This does not change local decision-making. However, if local health decisions believe that lower phases were appropriate, they have continued power to make those decisions. So the basic bottom line of this is that our state, most of our businesses will stay at 50% capacity for most indoor activities, but on June 30th, that will be lifted to go back to 100%, full reopening on June 30th. That would mean on June 30th, we would have full capacity for our restaurants, for our movie theaters, our bowling alleys, you name it. This full reopening can happen earlier, as I said, if we obtain 70% of Washingtonians who are over the age of 16 who have at least initiated their first dose of the vaccine before then. So, put simply, if 70% of those over 16 get one dose, we'll be in business, we'll be able to open before June 30th. We hope that that could happen. The status today is that more than 57% of eligible Washingtonians have received their first dose, and more than 43% are now fully vaccinated. And we have to continue this effort to save more lives. Now, we have some disparate county performance as far as vaccinations. I'll put up a graph here if we have it to show we have significant deviation in vaccination rates from county to county. We have a lot of progress we can make in many, many places. I'll show you a bar graph that shows where the counties are in their percentages, and you'll see that it varies quite significantly. Every Washingtonian in every county is a life we care about, and every Washingtonian we hope will avail themselves of this free, safe vaccine across the state of Washington. If we do that, we'll be able to open sooner. But more importantly, we will save thousands of lives in our state. Trends suggest it won't be until late June when we reach our desired vaccination rate, which is why we've set June 30th for our reopening. But I hope people will see this as an opportunity to move faster, and certainly that is a possibility. We recently administered our 6 millionth dose of the COVID vaccine, and doses administered are about 46,000 a day on average. But we can do a lot more than that right now because we've got supplies to do a lot more than that right now. And if we can only motivate more people to take advantage of the personal benefits of this vaccine, which is saving your life and saving those around you's lives, we can do much better. So there's a lot of good reasons to get this vaccine, and there are no bad reasons in getting this life-saving treatment. Now, we do have some things, obviously, we have to be aware of. This does not mean that our state of emergency will end on June 30th, because this remains an extraordinary emergency that is created by the pandemic. The virus is not done with us, but we have a new chapter in a vaccine that we should fully implement. There is one metric that could change this, and that is our ICU, our intensive care unit capacity. We obviously can't allow our hospitals to be overrun. So if our statewide ICU capacity reached 90% at any time, we of course would need to roll back some of our activities. But if we remain on this course of getting vaccines, we don't believe that's going to happen if we'll all step up to the plate. I should say too that counties with lower vaccination rates, we're gonna have to look at the infection rates real carefully there, and local health districts will still have the ability to respond to local outbreaks should they occur, and those local public health districts will be able to act accordingly. Now, we know the CDC, the President, has announced new masking guidance for fully vaccinated individuals, and we are adopting those recommendations today in the state of Washington. I do want to stress these recommendations, as celebratory as they are, they refer to people who are fully vaccinated. That means people who are 2 weeks after their second dose, who had the Pfizer and Moderna shot, and 2 days after the one shot, or 2 weeks after the one shot, a Johnson & Johnson vaccine. So we're going to update our guidance documents, working with the Department of Health and Labor and Industries, to reflect this as soon as possible. Businesses, I should note that this change, businesses will retain the right to require customers to wear masks. So an individual business legally will be allowed to require their customers and their employees to wear masks. But there will not be a requirement if you are fully vaccinated from the state of Washington. And this is a heck of a benefit. Look at people who have been annoyed by this mask as a really good reason to get vaccinated. This is a ticket to freedom. That shot is a ticket to freedom from masks, and we hope people will avail themselves to it. By the way, obviously this guidance, this change in masking requirements will not pertain to hospitals, long-term care, doctor's offices, correctional facilities, homeless shelters, or schools. And the federal order requiring masks on public transportation will remain in effect. Now we have some really good news. Children as young as 12 are now eligible for the Pfizer vaccine, and the Department of Health is allocating vaccines to ensure that providers have a sufficient supply. We are encouraging school districts to partner with local providers for on-campus clinics. Those are already happening, or clinics at other easily accessible locations. We know that vaccines are fundamental to this next chapter of this journey, so we don't have to rely on social distancing and restrictions. We are confident this can work, but we need everyone to pull on the rope here. We don't want to see this pandemic coming back, which it could, particularly with these new variants. This does not change our responsibilities. It just increases our possibilities. And we all have the power to influence this. This is a different pandemic strategy, but we need the same level of commitment, the same level of energy that has been put us in one of the best positions of any of the states in the United States. We've used that energy and diligence before, and we want to use it again. There's a young man, a 12-year-old, just sent me a note. I wanted to read it to you, if I can. This is a 12-year-old Brody Inslee, our first grandchild. He just got his vaccination this afternoon. I'll post a picture of him. Here's what he had to say, and this is his own language. If you get vaccinated now, then you can hang out with your friends. And even if kids have a lower rate of getting COVID, they still can get it and pass it on. No one was stopping me, and no one is stopping you except yourself. I think that's pretty eloquent, and I'm kind of proud of that young man. Good leader. Now, when it comes to schools, we expect all of our school districts will open full-time in-person learning in the fall, with remote learning option for students who wish to remain in a remote setting. The Department of Health has posted new fall guidance for school districts, which update health and safety requirements. And they also add flexibility for some of our previous social distancing requirements. And there is nothing in this guidance that would prohibit in any meaningful way the ability to have full-time on-campus learning. We know it's possible to have distancing requirement could be removed altogether in the fall if we have a sufficient percentage of students who are vaccinated. We're also going to ramp up COVID testing at schools in the fall with funding that is available to schools for testing and health screening. This will be especially important for districts in areas with low vaccination rates and while younger students aren't yet eligible for the vaccine. An additional strategy we are pursuing are incentives. Now, there's a lot of really good incentives for getting this vaccine. One, you might not die. Two, someone you love might not die. Three, someone you love may not end up in the hospital. Four, you now can go out without a mask. But we are looking for even more incentives. So as other states have done, we're looking for ways to expand people's incentives to pursue this safe, effective, life-saving vaccine. Effective immediately, we will be allowing additional activities with fewer restrictions, as we've talked about, and increasing capacity for groups of fully vaccinated people. Spectator events such as indoor and outdoor sports will no longer have limits on the number of vaccinated individuals. Small cruise ships with less than 250 passengers can sail if a crew and 95% of the passengers are vaccinated. Conferences and live performances, weddings and funeral receptions can be at full capacity if the attendees are fully vaccinated. Our Commerce Department is also partnering with the Association of Washington Businesses to help local chambers of commerce to provide free gift cards to vaccinated individuals that can be used at small local businesses. So we're incentivizing people to get a vaccine, and we're also helping our Main Street businesses. It's another example of how vaccines and economic recovery actually work together. We're also working with the Seattle Mariners, and starting at the home game tonight, prizes will be giving away to vaccinated individuals at the games from partners like T-Mobile, Alaska Airlines, Microsoft, Costco, Nordstrom's, and more. I saw the Seattle Rainiers doing good work in this regard as well in their opening game. The Liquor and Cannabis Board is also working on a request from wineries and breweries to allow them to buy a glass or a pint for vaccinated customers. More ideas are in the works as well for our incentive programs. We also have good news for small businesses. Earlier this week, the Department of Commerce released another $234 million in Working Washington grants to nearly 12,000 small businesses. And you can find these grant recipients in every county in our state. More than half of these businesses have already received grants before the ones we just announced. 20% of recipients say they'll use these funds to reopen their business this year, and I'm heartened to know that. To date, Commerce has distributed more than $350 million in relief grants to small businesses hurt by the pandemic, and more is coming with additional funding for grants in the budget just approved by the legislature. So with that, happy to stand for your questions. Dr. Shaw is also available if you have questions, and also Lacey Fehrenbach of our Department of Health and Nick Struley is on the line if you have any questions. So you may fire when ready. Gridley.
Up first, we'll go to Lisa Bauman with AP. Go ahead, Lisa.
Josie, excuse me just one moment. Can you hand me the graph on the counties? I don't have a copy here in case I get a question on this. I could use copies for the governor here. Why don't you stand them all to me and I'll find it. Thank you. Thank you.
All right. That we will go to Lisa Bauman with AP. Go ahead, Lisa.
Hi, Governor. A lot of news here today. I want to touch on the mask CDC guidelines that came out today, and you said that Washington State will be adopting those as of today. And can you talk a little bit about the difference? So this is for fully vaccinated people, not people who have only one dose of the vaccine. Is that correct?
That is correct. So what we're announcing today is that fully vaccinated people will be freed from state restrictions, outdoors and indoors, that have previously been put in place, except in the environments that I talked about, hospitals, schools, and the like, and public transportation, I might add. That was an additional part of the CDC. So, yes, it does apply to fully vaccinated individuals.
Next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
I just want to follow up on that for clarity. Are you saying that starting immediately then businesses like restaurants and stores don't need to have people masked up if they're fully vaccinated, but they can still do it voluntarily if they like? And then my second question is, do you have concerns that there's been concerns that allowing people to not wear masks would send the wrong message on some of the guidelines as the state still tries to get people vaccinated? Are you concerned about that?
Well, I actually think it's the reverse. Our hope, and there's a reason for this, is it will increase people's interest in fighting COVID because it will give people an additional incentive to get vaccinated. We know that the single most powerful tool, the big gun in our arsenal, is the vaccine. And anything that makes it more likely that people will get it is really bringing the big gun to the battle. And we're doing that because now you'll have an additional incentive of being able to go to restaurants and grocery stores and everywhere else without wearing a mask. And that will increase people's incentive to become vaccinated, which is the ultimate way out of this. This is our ticket to the ultimate relief from the pandemic. So we think it will actually increase compliance, if you will, of people getting involved in this mission statement. That is what we're dedicating ourselves to. I think it's the rationale for the president, as I understand his thinking. Your statement about the grocery stores is correct. The state will not have a restriction. If you are fully vaccinated, we are not going to have a restriction on your ability to go into a grocery store without wearing a mask. But the individual grocery store business owner maintains the right to have their own decision-making who their customers are. So if they want to maintain a mask requirement for their customers, this would not strip them of that right as a business owner.
All right. Up next, we'll go to Laurel Demkovich with the spokesman review. Go ahead, Laurel.
Hi, Governor. I have two questions. The first, on that mask mandate, how are you suggesting to businesses or other places to check for who's vaccinated and who's non-vaccinated? Should we be carrying around our cards, pictures? What's the guidance there? And then secondly, probably for someone at DOH, I'm wondering if someone can explain a little bit about the risks that probably still exist with vaccinated people being around potentially unvaccinated people who aren't wearing masks because they now might have freedom to not do that as well.
Well, in answer to your second question, this does not prohibit anyone from wearing a mask. If you are vaccinated and you want to further protection, you're entitled to wear a mask anywhere you'd like to for any time. So this does not prevent people. If they would like to add to their level of protection, they are free to wear masks. We are certainly not reducing that. Now, the reason we're making this decision, however, though, is these vaccines are extremely effective. They're one of the most effective medicines we've ever invented. They have, as much as 95% effectiveness. That is an incredible scientific achievement. So we think people are tremendously protected by these vaccines once you're fully vaccinated. And that's the legitimate, scientifically sound reason we're making this decision. Your issue about checking, we have not imposed a checking requirement on businesses at the moment. That's not part of our plan. Now, could that change? It's possible. We just got this news from the federal government a few hours ago. But at the moment, we're not imposing some confirmation status by businesses. But again, they are legally entitled to do so. So if a grocery store or a restaurant wants to check people's status, they have the legal right to do so. I think you're going to find some businesses want to do that because more of their patrons want to be in a mask facility. So this will not end the masks, but it will end the state telling you to be masked if, in fact, you're vaccinated. And that is a rational, reasonable approach. We hope it leads to more people getting vaccinated, which is the ultimate goal here.
Lacey, did you have something you wanted to add there?
I can quickly add for businesses that want a way to check, there are multiple ways to show proof of vaccination. That includes the card you received when you got your vaccine, indicating your 2 doses. You can download your vaccine record from myir.net. And there is a click for Washington State, and they'll pull down your record for you. You can also, many people have access through their electronic health record, the patient-facing portal, and always a great idea if you have your card to take a photo of it so you have that stored on your phone securely as a backup.
And Governor, this is Umair Shah. I just wanted to jump in and first of all, thank you for allowing DOH to be a part of this. The science behind what the CDC said today, I think, is also important. What they're essentially saying is that vaccines are effective. And it's not just the theoretical effectiveness of vaccines. Now it's pragmatic real world experience that are showing that vaccines work. They protect the individual who has been vaccinated. They certainly are also protective against variants at this time, and certainly we're continuing to monitor that. And then it's also important that what the CDC has said is that the vaccines also protect individuals from spreading virus potentially asymptomatic or otherwise to spread virus to someone else. In other words, that if you are vaccinated, you are both protecting yourself, but you are also not going to spread virus to someone else. And that's why it's so critical that what the CDC released today was that really if you have received your vaccine, and I think goes along with the governor, what he said earlier, is that you are protected. And so the physical distancing and the masking requirements that were previously in place are now being alleviated because we know that vaccines work. And so the bottom line message here is to our Washingtonian residents is please get vaccinated. It protects you, it protects your family, your loved ones, and ultimately it's protecting the people around you. So we want to do everything we can to encourage and incentivize and just make the vaccine choice the right choice, the easy choice, and the choice that people make, because ultimately that's how we end this pandemic.
I do want to, is that people unfortunately are exposed to so many conspiracy theories and crazy thoughts. And if you read on the internet that you'll grow a tail if you take this vaccine, call your physician, call a nurse, ask them. I just hope people will do that. I've been very pleased the Washington State Medical Association and others, are the physicians and nurses and dentists are stepping up to the plate. They are sharing valid scientific information with their patients. That's ultimately what's most important here. I hope people, if they have any questions, just call a physician and talk to them about it and get their advice. They're the most credible figures in this regard.
All right. Up next, we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Governor, I've got two questions, one on COVID and one on carbon. On COVID, just for clarity, with the spectator events, it sounds like potentially a sporting event could have a sellout crowd if every fan is vaccinated. And with that in mind, I'm wondering if you envision or if you think teams will set up unvaccinated sections, limit the number of unvaccinated people in order to attract larger crowds. And then secondly, I just want to follow up on a question a couple of weeks ago. If you had time to decide and figure out, can you veto a provision that ties a low carbon fuel standard and climate change bill to a new transportation package? And if you can, will you?
About that, but I won't share them with you at the moment. We still are looking at some things. So we'll get back to you on that in a matter of a few days. On the vaccination, you are today eligible to have a section in your stadium of unlimited size for people who are fully vaccinated. And so, yes, they may decide to do that. Now, could they have a non-vaccinated section? Yes, there are limitations on the size of those that will remain, however, and you'd have to remain at 25% capacity for your non-vaccinated folks as well. So I doubt that actually will happen, but it'd be conceivable. By the way, the questions to date have not noticed that I mentioned that we're reopening the state of Washington on June 30th. I hope that isn't lost on the media industry here today.
All right. Up next, we'll go to Hannah Scott from Cairo Radio. Go ahead, Hannah.
Thank you, Governor. A couple of questions. First off, on the June 30th full reopening of the economy, what do you expect that to look like? Will we still be under a threat of having to watch cases and things of that nature, or is that just it until something more significant happens that would require any kind of a rollback? Is a rollback still a threat, essentially? And also, I know the governor of Florida has canceled all fines and penalties against businesses. I'm wondering if you might do the same.
No, we're not doing that. The law still needs to be followed, and we still have things that are important to people's health. So no, we will continue to enforce the law in the state of Washington as appropriate. As far as the thing that could happen, look, if ICU capacity goes over 90% and our hospitals are GN, we have to stop elective surgery. So if that's the one caveat, if the ICU capacity got overtaken, then we'd have to look at some other measures. But that's all we're saying today.
All right. Up next, we'll go to Tom Bancy with Public Radio. Go ahead, Tom.
Question for Dr. Shaw and a follow-up for the governor. Dr. Shaw, how did your meeting with your counterpart from British Columbia go yesterday? And did you talk at all about sharing vaccines, surplus vaccines from our state with our needier Canadian neighbors, possibly? And for Governor Inslee, has that topic come up in your office, or perhaps is the more broader issue of perhaps now's the right time to ease the northern border closure and help out all those border communities in our state. Is that something on your radar and maybe something you've communicated with Ottawa or Washington, D.C. about?
Well, Tom, first of all, thanks. It's great that you have a great memory from yesterday, and you know what you asked me yesterday, and as part of the Q&A, and then coming back today. So the meeting went great. It was the first time that I've actually met my counterpart there in British Columbia virtually, and it was really more of a get to know session. But we did talk about COVID vaccines, and the good news is that what she shared is that they're actually getting more supply now, and so there was not a formal request at all. In fact, she felt that now the supply was at least to the point where she was comfortable with where they were. So there was no formal request. And obviously, we said that, whatever we can do to work across the border, if you will, across from British Columbia and Washington, and be able to work together to share practices and share, models of activities and ways to do things, and to share across the two province and state lines. We would absolutely be excited about doing that. And so she was really enthusiastic about that, and we're now going to be meeting on a regular basis virtually, and hopefully sooner than later in person.
I have recent conversations about the border, but I believe I have a conversation scheduled next week, which I assume some of these subjects will come up. I would like to see progress in the near future on the border. I don't know exactly what that would entail, but given the progress we're making, the increased vaccination, I would hope that we can make progress on that in the upcoming months.
All right. Up next, we'll go to Chris Daniels with King 5. Go ahead, Chris.
Hi, Governor. Good afternoon.
Hello.
You were talking about incentives, and as you know, Ohio's governor is offering $1 million in scholarships to anyone who'll get vaccinated. West Virginia's governor is offering up to or $100 savings bonds. And you're talking about sporting events and maybe a free beer or a pint as an incentive. So I have two questions. One, would you encourage the Liquor and Cannabis Board to also allow, say, cannabis retailers to give free joints for jabs? Would you match Governor Mike DeWine's office to his citizens to play Who Wants to Be a Vaccinated Millionaire or something similar?
Well, of course, a pint of a microbrew ale, any pint from Washington is worth $1 million from Ohio, so we consider those equal incentives. But no, I would not rule out these kind of incentives. I actually have discussed with my staff the potential of this type of grand prize lottery. I think it actually could make sense. So it is something we're giving some thought to. I wouldn't rule out to legal products like marijuana, so I'm not ruling that out. We have a meeting scheduled, I think, next Tuesday about a further advance of these incentive programs. I do think they can be shown to be effective. And our goal is to save lives. And if you make a small investment to save thousands of lives, that can be a really worthwhile incentive program. So I think you're going to hear more about these things next week.
All right. Up next, we'll go to Alex Crescenti with KXLY. Go ahead, Alex.
Hi, Governor. Just curious regarding, so on June 30th here, can you clarify regarding, say, the Seattle Mariners, and they're opening up, so they can go to 100% capacity after that date there. And, with a follow-up question, is vaccine passports going to be something that you look at here down the line at all regarding, further sporting events with, Husky Stadium, with cruises, larger tourism as a whole here in the state?
Yeah, as far as the Mariners, they'll be able to have 100% if for people who are fully vaccinated. So with that caveat, yes. And there have been large events. I heard about a J-Lo concert in LA. Somebody told me they had 45,000 people who came in who were all vaccinated. So it is possible to organize and manage these fully vaccinated events. So that is a possibility. There would be some, but for non-vaccinated folks, there'd still be some requirements. We're giving some thought to changing those as to far as the percentages, but as of the moment, there are still some restrictions. So the relief valve is for fully vaccinated people at the moment. We are not anticipating doing state-sanctioned, quote, passports, but individual venues have the right to ask for some degree of proof of vaccination, and they are successfully, by and large, being able to implement those things. I think the Mariners have had success with it. I think the Rainiers have. So I think that this should be very viable.
Did you have something you wanted to add here?
Yeah, I just wanted to build on the governor's remarks. Large spectator events such as the Mariners games starting now. If they want to have a fully vaccinated crowd, they can get up to 100% right now, as the governor mentioned. And then on the other side of June 30th, once most of those business restrictions fall away, for some of these large events where there's a mix of vaccinated and unvaccinated individuals, those are ones that we'll have to give a little bit more serious thought to, with very large crowd sizes in the tens and hundreds of thousands of individuals. That's something we still need to think about. But for the vast majority of business restrictions on June 30th will fall away.
All right. Up next, we'll go to Jessica Perez with KNDO. Jessica, go ahead.
Hey, Governor. Thanks for taking my question. I have two. For that vaccine passport, is there any way to see if it's fake for those businesses that do want to check that people are vaccinated? And if not, is that just going to be their call to decide whether they're going to let that person in or not? And then you had also mentioned that vaccines are fundamental to the next chapter, so we don't have to rely on social distancing. Does that mean on June 30th, social distancing will no longer be a thing, or is that something we're going to continue?
Well, we certainly have a vastly reduced number of restrictions involving distancing. I just announced the major revision of repealing all of those restrictions for the vast majority of our businesses. There still will be some, as we indicated, for huge events and the like, some for public transportation, hospitals, some for schools, so there will remain some. But the vast majority of the businesses, frankly the ones that have been most concerning to us, they will be eliminated. As far as the passport, I'm not sure I totally understood your question, but we are not intending to create a state licensing system for vaccinations. And businesses will have the discretion on how they handle their operations in that regard. But what we are finding is in our state that those places that have asked for evidence of vaccination, it has been largely successful, that they've been able to show the vaccination card, and that's been just fine. And Lacey, you talked about the other online portal. Do you want to talk about that? I don't know if Lacey's still with us.
Yes, you can get your vaccine record on myir.net, N-E-T, and we can put that in the chat box for the reporters. There is a specific section for Washington State residents that will download your immunization record from RIIS. There is a matching process, so don't try to download it while you're standing in line at the Mariners. Download it the day before the game, please. But yes, that is one place you can always get your vaccine record. You can also often get it from your healthcare provider. And again, you can take a photo of it and store that on your phone in addition to keeping the card.
All right. Up next, we'll go to Keith Eldridge with Como 4. Go ahead, Keith.
Hi, Governor. Just for the record, I did take note of June 30th. That's my birthday, and I'll be as young as you coming up June 30th. The question I have is a couple of them. Why aren't you using the metric of those 12 and over, since they are now eligible for the vaccine in order to get to that 70%? And is there a consideration that you may have to re-examine the phasing process if all of our numbers, hospitalizations, cases start to go south?
Yeah, it was a good question. We thought about that. We thought that because we just got 12-year-olds, yesterday or today eligible, it wouldn't be seen as fair to require a 70% number when we just got them in the pool. So we thought this was a fair way to judge our level of progress. That was our rationale. As far as the phasing, what we've said today is that we believe if we continue increasing our vaccinations, if people pull on the rope, we will be able, and we're announcing that we're going to do this, which is to remove these restrictions on June 30th. Now, as I've said, if the ICU capacity exploded and got over 90%, we'd have to review those. But that's the only caveat that we're announcing today.
All right, we've got time for one more question, so we'll go ahead to Casey Decker with Crime. Go ahead, Casey.
Governor, the 90% occupancy requirement right now, I believe we're sitting a little over 82%. So is that a concerning number to you? How close is that really to hitting that threshold where we currently stand?
You said 90%. I'm not sure what you're referring to.
Sorry, we're at 82% occupancy now, and getting to 90%, how close are we to that realistically?
8%. And so far we've been generally plateauing or declining in our hospitalizations. When we do that, ICU generally follows that by a week or two. It's kind of a trailing indicator. So we're hopeful we'll be out, we'll be 10% lower than that in a few weeks. We hope that will be the case. So far, ICU capacity has been stable, and our hospitals have given us a high degree of confidence that we'll be in good shape with this strategy. But again, I do want to reiterate, look, if people stop getting vaccinations tomorrow, that would throw this in a cocked hat. We got to keep working on this. And there's no reason on this green earth not to accept something to save your life that's free. And so we all have to continue this effort. I believe we will. We have now brilliant children, getting this vaccine. I think they're going to do it in droves. And we're seeing more people that are just kind of getting around to it. There's a lot of people who have busy lives, obviously, and they just haven't gotten around to it yet. So we're trying to make it as accessible as well. It's one of the things we've not talked about today. We think this is a matter of convenience for a lot of people. So we're trying to make this as convenient as humanly possible. So you are seeing more and more pop-up clinics being started in grocery store parking lots. I drove by Eisenhower High School in Yakima yesterday, and they had one in the parking lot. Uber and Lyft is now offering free rides to people to go to these sites. Physicians will see an increasing amount of vaccine available in physicians' offices, which are obviously extremely convenient, and people are comfortable going to their physicians' offices. So both we and the federal government are making very concerted efforts to make this as ubiquitous as possible, as easy as possible, as comfortable as possible. And that's an important part of this mission statement as well. But if people want to save lives, we'll be there for them.
Any closing remarks?
No, I want to thank Washingtonians for the progress we have made and are going to make. I want to ask people to be leaders here, not followers, not just followers. It's good to follow sometimes too, but we're looking for leaders here. We need grandparents who have been vaccinated to talk to their children about the benefits of this. We need employers to talk to their employees. We need employees to talk to their bosses. We need neighbors to say, hey, it worked out for me. How you doing, Charlie? Just haven't gotten around to it? Well, I hope you do, because, I love you. I don't want you to see you get sick. And the more people who are leaders in this effort, the better off we're going to be. If we are leaders and if we care for each other, things are going to continue to improve. But I do believe this has been one of the most remarkable days in our state's history of a long year-and-a-half struggle. And that's a day when we free ourselves largely from these business restrictions, when we can free ourselves from masks if we'll get vaccinated, and if we have a goal in sight, which will allow us to return to some largely normal activities. And all it takes is a simple vaccination. That's going to see us through. Thanks very much. Be well. Go Mariners and Rainiers.